Hello, everybody. This is Pharmacist Keith Abell. I've got a special guest today, Dr. Joel Wallach, the Dead Doctors Don't Lie guy. He's a veterinarian, soil scientist, pathologist, naturopathic physician, and all-around good guy, as long as you're not a person in the pharmaceutical or medical world. We're going to talk today about nutrition, supplementation, and the role that those play in health and wellness. Dr. Wallach, welcome to the show.
Well, thank you, Pharmacist Keith. Always good to be with you, my brother.
It's good to be with you. Well, I wanted to start out today because you always talk about the need for 90 essential nutrients. And what I want to start out today is just talking about the different groups of those nutrients and what roles they play in your health and wellness. So first of all, you say there are 60 minerals. So what's the importance of the 60 minerals in our diet?
Okay. Well, each of the minerals has somewhere between 10 and 20 things that they do physiologically in our bodies. And of course, simplistically thinking, the medical system said, well, you need calcium. Everybody knows you need calcium. Just take some Tums and you'll get some calcium. Or just eat right. You get everything you need.
Yeah.
That's not true, especially for minerals, because plants cannot make minerals, okay? And nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like chocolate and chocolate ripple ice cream. They occur in veins like gold and silver and coal in the earth. And there's places on earth like near the Giltar Glacier in Hunza, which is between Pakistan and China, where people have the average longest lifespan on earth. There was actually a great book and a movie made of that in 1933 called Lost Horizon, talked about Shangri-La, where people live forever and so forth. And it's because the glacier grinds up the walls of the canyon that it comes down through, and it has all these minerals in it. Well, then you take a place like some of these places in South America where it rains all the time, and the last volcanic eruptions were 1 million years ago, so there's no minerals. And the average lifespan is 45 instead of 150. And so the only way you're going to maximize the benefits of these 60 minerals, which all vertebrates, including human beings, need, is to supplement. Now, what tripped me off to that was, growing up on a little farm, I was 4 years old and was have what they would call autism today, with some very aggressive, very mean physical stuff going along with it. And they didn't have a name for it back then. But after 5 years of getting worse and worse and worse, my parents took me to 20 different doctors in the big city of St. Louis. The last one was Mary Jane Skeffington, a kid psychiatrist and eye doctor and so forth. And they wanted to institutionalize me, put me in a mental hospital for the rest of my life. And I was only 9 years old. That didn't sound good. And that night when I went home, everybody else went to bed, and I'm sitting there in my bedroom thinking, why is it that all the animals on the farm are eating food that's grown on the same land that we eat food grown on the same land with, and there's none of the calves or none of the cows or pigs or chickens or llamas or whatever else we had on the place, none of them were having any problems like I had. And so it dawned on me, I said, well, wait a minute, I'm only 9. I said, well, wait a minute, we're giving all these vitamins and minerals to the animals in addition to the hay and the grain and everything. So I said, well, maybe I'm missing the vitamins that we're giving them. So the next morning, I put their food in my cereal bowl and dumped the Wheaties out, filled it up, ate it for lunch, ate it for dinner. Next day, breakfast, lunch, and dinner. Next day, breakfast, lunch, and dinner. And by the third day, I was cured after 5 years of getting worse and worse and be institutionalized for the rest of my life. And I realized by the time I was 9 that there was something to this supplementation thing. And veterinarians were 1,000 light years ahead of medical doctors when it came to the need for supplementation, because farmers would go broke if the veterinarians had to be out there taking care of the farm animals as much as the doctors were out there taking care of the people. So that's kind of basically how I kind of got into that. And then, of course, being a student, I had to work my way through school, and as a student, I worked for the pathology department and ran into the first mass die-off in America from pollution on Christmas 1962, and everybody else was off for holidays. And so I ran into this mass die-off where 500 died in one night. okay, from pollution, figured it out, got it published into scientific journals. So got it published. And I was so excited. I'm 22 years old. It was my first scientific publication. I give copies to senators, state senators, U.S. senators, governors, judges, salespeople. I gave it to Marlon Perkins from the old Mutual Omaha Wild Kingdom show because I had worked for him earlier as a kid. And when I graduated veterinary school in 1964, I had my degree in veterinary medicine. I had my degree in agriculture. I was halfway through my degree in pathology, and I went to Iowa State University to finish my degree in pathology. And Perkins said, I need you to go to Africa and work on the white rhino population program. So you can't refuse Perkins. So I went there and prepared to stay in Africa forever. I was having the time of my life. After 2 years, he sends me another letter, says, look, using your paper on that mass die-off from pollution, I got a $25 million grant from the National Institutes of Health to do all these autopsies to see what pollutants are killing people and animals in the big zoos in the cities, kind of like the canary in the mine thing. And I want you to be the pathologist on the project. Couldn't refuse him, so came back and did that for 10 years, did 20,000 autopsies, got them published, of course, in two ways. Number one, the piece on the animals in the big zoos, we were looking for the canary in the mine, 17,000 some change of over 454 species of zoo animals. And it was 5,000 pages. Just that piece of my research was 5,000 pages. And in the humans, and 3,000. And then I did 5,000 more autopsies on people. And I got a book called Epigenetics, The Death of the Genetic Disease Transmission. And the animals, the same thing. And W.B. Saunders, the top medical publishing house for textbooks and research books and so forth, published my thesis. And the animal piece is called Diseases of Exotic Animals, and the human piece is called Epigenetics, the Death of Genetic Disease Transmission. And myself, along with Bruce Lipton, are considered the fathers of the science of epigenetics. He studies identical twins that were separated at birth. Takes 30 years to find out the answer. Well, myself, when I'm doing all this research and pollution and everything, I got the answer immediately. So we're two different approaches, but we got the same thing, that there are no genetically transmitted diseases. And if you go on Siri or Amazon and look for my book on the diseases of exotic animals, which is the 5,000 pages, okay, they rendered it down to 1,200 pages and it sells as a textbook with a hardcover. The diseases of exotic animals. So you can get one still in the box, brand new, good condition. It sells for $25,000 each. That's W.B. Saunders Publishing Company. I looked yesterday, there's a couple of them for $10,000 each. They're used and in good condition. When they're used and beat up, they'll sell for $4,000 to $6,000, right? The epigenetics books, I think, sells for 25 or 30 or something like that, the 8,000 human autopsies. And my thesis is in the Smithsonian Institute's National Treasure, okay, because I proved there were no genetically transmitted diseases. Now, I'm not saying that to brag, I'm just saying that for credibility. And again, to make a long story short, you take your 90 essential nutrients, including those 60 minerals, you'll eliminate 600 different diseases. Most of those diseases, if you have them, are reversible. Things like high blood pressure, diabetes, arthritis, thyroid problems, kidney failure. We're on dialysis. I take people, Pharmacist Keith, that have not urinated in 10 years. They're on dialysis 6 days a week. They were on dialysis totally for 25 years. We put them on our program for that. In 2 weeks' time, they're urinating after 10 years of not urinating. And in 6 weeks' time, they're off of dialysis after 25 years.
Yeah, when you started out your business with your medical practice with just the plant-derived minerals. That's
correct. And of course, because we figured it was just easier and cheaper just to tell people, to run to the grocery store and buy some vitamins and things, or eat well, as everybody said. And then as I'm seeing these people, it was very obvious to me that they weren't even getting enough vitamins. They were getting scurvy and pellagra and beriberi. Right. And all this stuff. They're just different names. Beriberi, which used to kill sailors, 300 years ago, really the terminal event for beriberi was congestive heart failure, deficiency of a single vitamin. So we give them the 90 essential nutrients, and people who've been on medication for congestive heart failure for 10, 12, 15 years, in 3 weeks' time, they're off their medication or back to normal. Because congestive heart failure is 99% of the time is just a simple deficiency of a single nutrient.
Yeah. So that brought me to the next subject, was the vitamins. It always amazes me because when I was in pharmacy school, you learned about scurvy and the role that vitamin C played in it. And it just always amazed me that the pharmaceutical industry totally ignores, that information. Linus Pauling and all his research, they totally ignore that. And me and you've talked about it before. The main reason they ignore it all is because they can't patent those. Those are things that come from nature.
Okay, and of course, just a quick story about scurvy and vitamin C. That had gone on for thousands of years, okay? And there's a sea captain from England who had a little garden and a little orchard, and he'd come home once every 2 months or stuff like that, and he'd be there for a week and then head out again. And then in the fall, when all his stuff, the garden and the orchards, were ripe and he was picking stuff, every fall he would take a bucket of limes with him out to sea, and he wouldn't come home for a couple of months. And his crew was the only one that didn't die from scurvy. Everybody else in the world was dying of scurvy. And he didn't know why, but he reckoned and figured out there was something in the limes that he was getting from his orchard and bringing the limes along. And so all, and the bars and taverns of these various places around the world where his crew was talking with all the other crews from the other sea captain ships, they're saying, why, we had 6 people already died just coming out this way from scurvy. How many are going to die going back home? So, we never have that problem. Well, what are you doing different than us? And they're sitting there talking. He says, I don't know, our captain gives us these limes to eat all the time. And that's why they called the British limeys, because they were eating limes all the time. And they didn't know it was the vitamin C in the limes, but they knew that they connected consuming limes and lime juice with not having scurvy. And so that's why they called the British limeys, because they were eating limes from that one sea captain's orchards.
Well, one of the other categories of the 90 essential nutrients are the amino acids. So tell me what role those play and what deficiencies in those areas can cause.
Sure. Okay. Well, amino acids, of course, are the building blocks of proteins. Proteins are strings of amino acids. And amino acids and proteins make up the various tissues you have. Each one's a little bit different, a different makeup. And we're talking about there's liver cells, there's kidney cells, there's pancreas cells, there's lung cells, there's heart cells, and brain cells, and eye cells, and muscle cells, and bone cells, and tendon cells, and ligament cells. They're all kind of a mixture of proteins and connective tissue. Even the walls of arteries are like 2/3 of the thickness is connective tissue, like tendon material. And so you need the strings of these proteins, and you need the strings of these connective tissues, which are kind of a mix of proteins, to perform all the various things that these various specialty tissues perform. And on the sailing ships, salt pork was kind of a universal thing. They salted big barrels of pork, and that's what the sailors got for breakfast, lunch, and dinner was salt pork. Now, they didn't get any fruit. They didn't get any vegetables. They didn't get anything. They may have got some rum once in a while, okay? The alcoholic beverages and the salt pork, and that was pretty much it. And then when they'd hit land once every month or 3 months or whatever it was, they would eat as many vegetables as they could and so forth. But it depended on where the vegetables grew. The vegetables only needed 3 minerals from the soil, and the vegetables didn't have protein or amino acids in them, okay? They were primarily carbohydrates and fiber and things like that. And so unless you're eating lots of beans, okay, but I'm sure they ate fish and chicken and beef and lamb and pork and stuff like that when they hit land. So they're getting protein and the amino acids in the various forms. And it's one of those things where the whole business of supplementation really didn't come into its real being in the civilized world until the Second World War. When they're coming up with these artificial meals and the K rations and things like that. And, all the soldiers are getting scurvy and the sailors are getting scurvy again and so forth. So they had to come up with a vitamin mineral tablet, a 1 a day kind of thing they would take. And, you get maybe 6 vitamins and 3 minerals and so forth. It would take care of the more common things that everybody knew about. but didn't take care of things like chronic osteoporosis, and they just attributed that to old age. Well, people get older, they get osteoporosis and arthritis. That's just part of the deal. But those are all just simple nutritional deficiencies. And of course, they didn't even know about the absorption piece and gluten. So gluten damages your intestine and causes celiac disease, causes irritable bowel syndrome, causes diverticulitis, causes appendicitis. And of course, you couldn't absorb nutrients even if you're supplementing. And then you wind up with as many as 600 different diseases. Well, you got bad genes in your family.
Yeah. Well, one of the other categories, and this is what got me really into researching nutrition and supplementation, is the omega fatty acids. I had a customer come into my pharmacy one time, and this was before you got the FDA approval for different qualifications, health claims for the omega-3s. I had a customer come in one time, and they said that they heard that omega-3 will help lower their cholesterol and want to know how much to take. And I'm looking through all the research data, and I probably pulled 25 different articles from different journals, and all of them had the same answer. You know, you need 6,000 to 9,000 milligrams a day of the omegas. And then I came across an article that was in, I cannot remember now where it was in, JAMA or the New England Journal, which one it was in, but that article said fish oil did nothing. And that set this, light off in me, because I had a professor in pharmacy school that says, if you've got a body of information in journals that says one thing, and then you get an article that says something else, you have to ask 3 questions. Who funded it? What do they stand to gain or lose? And what did they do to get the results? So that's when I started comparing all these articles, and I found that the one that said it did nothing, they only gave the people 1,000 milligrams of the omega-3 because they knew that it was going to fail. And that's when I started going through and looking at every time there was an article that says something didn't work, when we've always known that it did something. Every time I found out they were either given a dose that was too low, or they were given some dosage form that doesn't absorb well. And that's what they did in order to prove that it doesn't work, and that you need their magical pharmaceutical drug that they advertise on TV.
Yeah, the statin drugs. Yeah, well, statin drugs were the beginning of Alzheimer's disease. Alzheimer's disease didn't exist before statin drugs. There's lots of different dementias. There's 8 different dementias, 7 of which were around for thousands of years. One was with pellagra, one was with beriberi, one was with osteoporosis of the skull, one was with, scurvy. They were with every kind of thing you can think of, all these dementias, hardening the arteries and so forth. And of course, when they came out with the statin drugs, it lowered the cholesterol. And then everybody got Alzheimer's disease, because Alzheimer's disease is caused by a deficiency of cholesterol. Cholesterol does not cause plaque in your arteries. There is no cholesterol in plaque in your arteries. There are no diseases of the heart that are caused by cholesterol. And if you get off of all the fried foods and processed meats and oils and glutens, wheat, brown, rye oats, and take your 90, right, your Healthy Brain and Heart Pack, or even just the Healthy Start Pack, the basic core program, your arteries will heal, blood will flow through there, your blood pressure comes down, your memory comes back, because there's a form of dementia, memory problem, is called vascular dementia, where your arteries are all plugged, you don't get enough oxygen to the brain, and you can take all the statin drugs you want, it's still not going to get your memory to come back, because it's not a cholesterol problem, okay? It's a plaque in the arteries, which is caused by eating the oils and fried foods and so forth.
Yeah, doctors, they saw the buildup in the arteries, and they assumed that the buildup was the problem. They totally ignore that a lot of times the buildup was being caused with some type of inflammation or some other thing from the foods that you're talking about, and it was the body trying to protect itself from damage from the inflammation. It would build that little patch in the arteries to cover that up, so you don't get a leak in the artery. So doctors assume, well, that's the problem, is the patch that your body is doing naturally. We need to get rid of that, instead of what's causing it. That drives me nuts, the whole medical system. They never get to the what's causing it. They get to the what can I do to help you, improve your symptoms, but not what's causing the symptoms. It's like when you're driving the car down the highway and that little red light comes on the dashboard and flashes off and on. The doctor wants you to pull over and cut the wire to the light, give you a pain pill, give you a cholesterol drug or something like that. They don't want to find out why that light's coming on.
Yeah, put you on dialysis.
Yeah.
Yeah. 99% of the time when they put you on dialysis, there's nothing wrong with your kidney. It's the plaque in the arteries taking the dirty blood into the kidneys are causing the problem. And so I figured that out doing these autopsies. Because when I would do autopsies, if people were on dialysis, I said, there's nothing wrong with their kidneys. Why are they on dialysis? Well, their blood test showed that their kidneys weren't cleaning the blood. I said, well, that's because the arteries carrying the dirty blood into the kidneys were blocked and they weren't even getting the dirty blood to clean.
Yeah.
And so we came up with a program to clean the arteries out, and suddenly now the kidneys are working. And we take people, Pharmacist Keith, that have not urinated in 10 years are getting dialysis 6 days a week, okay, because they hadn't urinated in 10 years, and they were on dialysis for 25 years, and they didn't want to get a kidney transplant. Yeah. And so we get them on our program, and in 2 weeks' time, they're urinating. In 6 weeks' time, they're off of dialysis after 25 years, and they started urinating again after 10 years of not urinating. We do this thousands of times a year all over the world. And you'd think, if I was a medical doctor, I'm sure I won a Nobel Prize for that one.
Yeah. Another thing you mentioned a minute ago, when they, started looking at the statin drugs as the answer, and really there was two things that came out of that research back then that led them to cholesterol being a problem. And it also, the same research was used to support the idea that these artificial vegetable fats is what we should be using instead of lard and butter. It all came from that same research. And I know we've talked about it at length.
Mm-hmm. Yeah. And of course, fat in itself is not bad. Fat doesn't make you fat. Fat doesn't cause any disease. Burnt fat causes disease. When you start heating fat and turning it into trans fats, heterocyclamines, and acrylamides, that will cause the plaque in the artery. Salad dressing, you go to a restaurant and they have these little bottles of salad dressing on the table, and it's been sitting there for 2 weeks at room temperature, because they don't take them into the refrigerator every night. They just leave them out on the tables. Even if you put it in the refrigerator, within 6 to 8 to 10 weeks, the oils in that salad dressing have turned into trans fats, heterocyclamines, and acrylamides. And if you use that 2-3 times a day, you're going to get cancer. You're going to get plaque in your arteries. You're going to get osteoporosis. You're going to get high blood pressure. You're going to get every kind of disease you can think of. And when you're 60 years old, you'll be one of these people with 18 different pre-existing conditions, all these different diseases. And people say, man, your family's got bad genes. You got all these genetic diseases. No, they're all a combination of nutritional deficiencies and inflammation caused by eating oxidized oils.
Yeah. I think it was Ansel Keys, if I remember right, that did the study. What he was looking at, he theorized that fat caused heart issues, heart attacks, that type of thing. So he did this study with all these different countries around the world, first world countries, and was looking at their diet. And he wanted to prove that high fat diet caused, artery diseases and heart disease. But what happened is he kind of picked and chose the results that he got, because he had a lot more countries in his results than what he published in the end. Some countries had a high fat diet and had no problem with cardiac problems. Some countries had a high fat diet and did. And when he published his study, he only put the data in for the countries that had the high fat diets. And that information was backed by one of the companies that has the artificial vegetable oil product.
Well, there you go.
The statin drug companies took that exact same research that he did, and they used that to prove that, you need to have a statin drug instead of having cholesterol problems. It was the exact same research was used by two different groups of people. Mm-hmm. It was flawed research. It was a lie. Dead doctors don't lie.
Yeah, dead doctors don't lie, and they kill a lot of people, the number 3 cause of death in hospitals, the number 3 cause of death ultimately in hospitals is medical errors, including ones like you're talking about. This is Johns Hopkins just came out with this 2.5 weeks ago. Johns Hopkins just came out with this 2.5 weeks ago, okay, published. They said the number 3 cause of death in hospitals is medical errors, okay? Each year, medical errors in hospitals kill 250,000 to 440,000 patients, and doctors get a wad, okay? Johns Hopkins published that. Now,
and that's just the U.S., right?
That's just, no, that's just the U.S. Now, here's the one that really ticked me off. When you get to sudden infant death syndrome, crib death, remember that Milan and I went to China, Qishan province, China. We did 1,700 autopsies on kids under the age of 10 because they had the highest rate of kids' death in the world in Qishan province under the age of 10. And I, let's see here, did 1,700 autopsies in 6 weeks on kids under the age of 10 dying from this one disease called Qishan disease. It's a deficiency of a single mineral.
Right.
These 1,700 autopsies, 35% had cystic fibrosis, 100% had muscular dystrophy, and 200 under the age of 1 year that died of this Qishan disease had what would be called in the United States sudden infant death syndrome. So using that, I get a win in federal court to force the manufacturers of baby formulas, Enfamil and Similac, to put that one nutrient in the baby formula. The federal judge couldn't argue the 1,700 autopsies on kids under the age of 10, okay? It was published in 3 languages. The English version is in the Journal of Trace Element Research, okay? So everybody who said, that can't be right, Wallach, and so, yeah, go look it up. 1990, Journal of Trace Element Research, 1990, it was called Qishan disease, okay? And so they forced these manufacturers, Enfamil, Similac, and all the other formulators of baby formulas to put this one nutrient in there. For 50 years, medical doctors have been telling baby formula manufacturers, don't put that mineral in there because it's a poisonous mineral. Okay, and that's why we had so much trouble with, quote, genetic diseases like cystic fibrosis, muscular dystrophy, and crib death. Well, it turns out that only 2% of the babies that die of crib death were in bed with their mother when they died. 98% weren't. Right. 100% were on baby formulas. None were being breastfed. None of them suffocated, because I went back and redid several hundred autopsies, and none of them suffocated. They all died from Qishan disease, this hypertrophic cardiomyopathy heart disease. So a year later, September 13th, 2014, after this was published, okay, April 16th, and the judge ruled in our favor because of that publication in 1990. April 16th, 2013, the judge ruled in our favor. A year later, September 13th, 2014, headlines, front page, like big bold letters, like Third World War, in the Charlotte Observer, the big newspaper, like New York Times for New York, for Charlotte, North Carolina, big headlines. We don't know why. Now I'm quoting the cover headline. We don't know why, but sudden infant death syndrome has vanished in North Carolina. 3 months later, in all the newspapers in the state of Missouri, including the St. Louis Post-Dispatch, we don't know why, but sudden infant death syndrome has vanished in the state of Missouri. 3 months later, every newspaper in the world published a front page article said, we don't know why, but sudden infant death syndrome has dramatically dropped by 85 to 95% in all countries. Well, that's because I forced them to put that one nutrient in the baby formulas that doctors forced them to keep out. And so it was the doctors ultimately were the cause of sudden infant death syndrome.
Yeah, I pulled those articles to look at them, and they really did publish that, and they really emphasized the we don't know why.
Exactly.
And, you would think that they would ask the question why.
Yeah. And
that's what just drives me nuts. When I was given this cassette tape, when I was in pharmacy school, it just opened up my eyes. I was already questioning the professors about, we know that all these minerals drive different chemical reactions in your body. If you're deficient of a mineral, you're not going to get the reaction that you need to produce the vitamins and the amino acids and break down the carbohydrates and all that. So my whole time in school, it's like, why, if we know this, are we not looking at that as a way to help people get better. But no, you got to take your beta blocker for the rest of your life. You know,
Well,
you
that's
got to
because,
take Prozac for the rest of your life. We don't
yeah, well,
have a
that's,
beta blocker and a Prozac deficiency. We've got essential nutrient deficiency.
yeah. Well, pharmacist Keith, the reason why doctors do that, and the reason why pharmacists push that, is the pharmaceutical companies give them money to send their kids through college. Okay, it's that simple. And I hate to see it, but the medical profession has been turned into a pack of criminals for money instead of the truth. And every once in a while, we'll find somebody who's interested in the truth, like yourself. I actually talked to a medical doctor 2 days ago who was 88 years old. He was a medical doctor and an attorney. And he had like 12 different diseases, right?
Yeah.
All his buddies in his clinics that he was working with all these years were giving him prescriptions for all these diseases, which are just simple nutritional deficiencies. I spent 2 hours on the phone with him and his sponsor, one of our longevity associates, and he's just foaming at the mouth, getting angry and angry. He says, yeah, I'm looking this stuff up online as you're telling me, and you're right. How come we don't know this? He says, well, that's because your professors, in the schools are getting paid so you don't know it.
Yeah.
Okay. And so, you don't like to think that, but the most important thing for the medical system was health insurance, because it got people who couldn't afford doctors to go to doctors, and then doctors got paid by the insurance companies. And then, of course, the pharmaceutical industry pushed their side of it. And so the doctors kept saying, take Tums for calcium when you had osteoporosis,
Yeah.
instead of taking all 90 essential nutrients, because your bones need more than just calcium. Your bones need 90 essential nutrients.
Well, there's a famous Kentuckian, I think me and you would say infamous Kentuckian, named Abraham Flexner.
Uh-huh.
And he has a big role in the way our medical system runs nowadays. You talk about that, and I don't remember if it was in Dead Doctors Don't Lie, but I know it was in one of your talks.
Yeah, it was
you
mentioned.
Talk about Abraham Flexner, and go ahead.
No, you start.
Well, I was going to say how he was hired by the Rockefellers and all these big pharmaceutical magnates to go around the country to every medical school that there was out there and find out what type of medicine they were teaching. If they were teaching allopathic medicine, which is the use of pharmaceutical drugs, then those hospitals got big grants from these guys. And if they weren't teaching it, they were not funded whatsoever. And that's how the allopathic medicine has become the standard of care in the United States.
Yeah, well, you get an A+, my brother, because you're exactly right. And of course, all the hospitals and all the medical schools and all the pharmaceutical companies saying, well, yeah, you need to look at that Flexner report, right?
Yeah.
Because they're steering you in the wrong direction. You don't want to go that direction.
Yep.
You want to know the truth, and the truth is through us.
We've got several hospitals on a street called Abraham Flexner Way right here in town.
Wow.
So what's the difference between allopathic medicine and naturopathic medicine and some of the others? What's the difference in how they look at treating?
Well, actually, it depends on what school you go on, because there are some naturopathic schools that are more allopathic than allopathic schools, right? And for instance, most even naturopathic schools still believe there's some genetics involved in some of these diseases where you have 5 generations of your family with diabetes or something like that. No, they all live in the same county. They all eat the same way. They're all eating a lot of bread and spaghetti and pancakes for breakfast and breakfast of champions, Wheaties for breakfast and that kind of stuff, and hamburger buns. And they're getting all this gluten, and they cannot absorb anything. So everybody in this county is getting all these diseases, whether they supplement or not. See, it doesn't matter if you supplement. Look, these guys are taking all these supplements. They still get diabetes. Well, that's because they couldn't absorb those nutrients because their intestines are damaged. And they say, well, why is it suddenly now when I'm age 60, I started getting all these diseases and I've been eating gluten all my life? Well, that's because gluten doesn't cause a problem. I mean,
I've got a couple questions. Before we go there, I guess I better read the disclaimer that the FDA and FTC and everybody else wants us to read. Any food and dietary supplements mentioned in this presentation are intended to contribute to the daily diet and overall health and are not intended for use in the prevention, treatment, mitigation, or cure of any disease or health-related condition. Individuals who have or suspect that they have an illness or wish to commence a diet or exercise program should consult an appropriately licensed healthcare practitioner for a medical history evaluation, diagnosis, treatment, and health recommendations. And I always want to add further to that, seek out medical professionals that want to take a more holistic look at the body, not just prescribing a pharmaceutical, but want to look at a holistic approach. I mean, I'm a pharmacist. I dispense medications. My opinion on it is the medications are supposed to be temporary until you can get your body to help fix itself. And that's why I relate so well to Dr. Wallach and his message. I recommend get the Dead Doctors Don't Lie tape. Get the Let's Play Doctor book. Get Dr. Wallach's 4-pack of books.
Yeah, the quartet of books we call them. Yeah, including the new one. It's all in your head.
Yeah, there you go.
Yeah, there's 25 different diseases you get from osteoporosis of the skull. And you go to all these different specialists, neurologists and ear doctors and eye doctors and throat doctors, and you get all these expensive implants and surgeries, and you get neck surgery and back surgery. You get carpal tunnel surgeries and all this kind of stuff. And it's really just osteoporosis of the skull. And oh yeah, all the dental work is caused by osteoporosis of the skull, receding gums, loose teeth, migrating teeth. That's where these kids need to go to these dentists that put braces on them, and so forth. It's amazing. And of course, it tells you in this book the 90 essential nutrients you need to take to prevent this or reverse all these diseases. You're going to see all these fancy specialists when all you need to do is take the 90 essential nutrients and get off of gluten so you can absorb them.
Okay, Rhonda asks, she has lipidemia and she got an infection in her leg. So the doctors think it's cellulitis. They've gone through 3 rounds of antibiotics and wonder if they still have an infection or if something else is going on.
Well, the odds are there's something else going on. The odds are she has a gluten problem. She's got celiac disease. They haven't diagnosed it, and she doesn't have belly pain or anything like that. And so she's not absorbing all these nutrients. And what happens is when you have the blood return coming from your legs through the veins, right?
Right.
They have to go through the same veins that the blood goes through from your intestines. And since your intestines are all plugged up, those veins are being pinched. And so when you get this lymphedema and edema in your legs and so forth, and nothing can solve it, is because you have a gluten problem squeezing the veins, the return veins in your body. And so the blood can't get back to the heart. Okay. So here's a case where you need to get off the gluten. Absolutely no gluten of any kind, no wheat, no barley, rye, oats. Well, I bought the gluten-free oats. Well, there are no such things as gluten-free oats. The gluten in oats is called gliadin. When you look at an analysis of oats, it doesn't say gluten, it says gliadin. So you say there's no gluten in there. Well, gliadin is gluten.
Yeah, you look at the chemical structure and they're very similar.
Yeah, and so you have to stay away from them and get on the 90 essential nutrients, including what I like to throw in when you start getting edema in the legs or any place else. I like to throw in the Ultimate Daily Classic Tablet. Supports healthy blood pressure, but also supports healthy blood flow through blocked arteries, as it reduces inflammation in the lining of the arteries. And this is one of those things where this book here, it covers that, because when you start getting a lot of these issues in the skull, including you start getting say edema of the 8th cranial nerve, the nerve that controls the thinking in the brain. And people say, boy, I can't think very well today. Well, that's because you got edema in the brain squeezing those nerves, the auditory branch of the 8th cranial nerve, okay, and also the vestibular branch, which is for the spinal cord of the 8th cranial nerve. And it's one of those things where you have to be very, very careful. And it's one of those things where you have to get rid of the cause, which is get rid of the gluten.
Right.
Right? No wheat, bran, or iron oats, so your intestines will heal. And then you will not have a problem. Your body can heal, your intestines can heal in, say, 4 to 6 weeks. But you got to be on it and avoid all the gluten so you can, and take the 90 so you can heal.
All right, next question I have is stroke. 80-year-old woman just had stroke. History is back when she was in her 50s, she had a quad bypass. Nothing since then until this stroke. It was very mild. Only an 80-pound lady.
Okay, well, of course, stroke, when you get a blood clot in an artery, okay, or a vein, either way, and you can't return blood or you can't pump out blood, these blood clots are caused by a deficiency of omega-3s, okay, and omega-3s are required to prevent blood clots. Is one of the 20 things that omega-3s do is keep the blood flowing and prevent that. And so, but you got to get rid of the gluten out of your life so you can absorb the omega-3s, because if your intestines are damaged, one of the biggest structures you have to absorb are the fatty acids. And so as, this is why everybody, when they get over age 50, 60 years of age, they start getting blood clots here and there, and they start getting fat, cholesterol, plaque in the arteries and everything, is because they're missing these nutrients, which prevent all that. And so this is where these books, I like the quartet of books there, you know, the Let's Play Doctor, Let's Play Herbal Doctor, Passport to Therapy, and the fourth one, It's All in Your Head, okay? Right. And they cover 600 different diseases, what causes them, how to prevent them, and what to take nutritionally to reverse them. And it's one of those things where you have to be really proactive. You can't just say, well, you know, I have a doctor, he'll give me bypass surgery if I get a blood clot in my artery. Well, you don't want to get a blood clot in your artery because you may not live long enough to go get the bypass surgery.
Yeah, this particular person is someone I know, and I actually was able to sit down with the hospitalist, and he agreed with me on increasing omega-3s and did not put this person on any blood thinners. Just put her on a triglyceride drug to get the triglycerides down. And I know the omega-3s will do that as well. So he wants to see her in 6 weeks to see if we got that under control, just using those two methods. So I was amazed.
Yeah,
a doctor that was open.
Yeah, as long as she's avoiding gluten,
yep,
then she'll be able to absorb those nutrients. But once you damage the intestines, the villi are gone. It's a slow process over a period of years. And that's why you see, and I hear this so many times, but I've been eating oatmeal all my life. Why suddenly at age 70 am I having a problem? Well, that's because now 90% of your intestines are damaged. It took you 60 years to go from a healthy intestine to slowly, bit by bit, cell by cell, losing the lining of your intestine. And now you've lost 90% of your lining of your intestine, and now you're starting to get clinical diseases. Back when you only had 50% damage, your intestines could still absorb enough nutrients so you could avoid these problems. Well, now you have 90% 90% dead tissue in your intestines. You cannot absorb these nutrients, and that's why you're getting the disease. And so it's one of those things where you have to understand what's going on. Doctors are not taught this in school, and that's why only dead doctors don't lie.
Got another question for you. We don't have a lot more of time left, so I'll get to this one. This person said had a full thyroid removal after thyroid cancer 20 years ago, has had molar pregnancy and stage 3 abnormalities in the cervical smear test. She's wondering if they're related.
Well, they were related from the
point. She's been suggested to have her thyroid replaced.
Okay, well, you can take, thyroid medication to replace your thyroid. That's not the issue. The issue was you weren't absorbing the nutrients your thyroid gland needed, so the thyroid gland could make its hormone, because you had problems in your intestine because of gluten. And so the gluten doesn't just narrowly block the absorption of one nutrient, it blocks all the nutrients, blocks medication. And people said, yeah, the oral medication didn't work for me. I had to take injectable insulin. So the doctor said I had type 1 diabetes. Well, how old were you? Well, I was 65 years old, and he diagnosed me with type 1 diabetes. No, you're born with type 1 diabetes. It just means your intestines were severely damaged. You couldn't absorb the nutrients necessary to prevent diabetes. And so you had to go around the intestines with an injection. Okay, and so this is why he said you had type 1, because he's missed it all these years because he didn't tell you to get off of gluten.
Yeah, so the gluten is definitely the biggest part of it. And another thing, when it comes to cancers, a lot of time too, it's you're getting way too much sugar in your diet as well. And sugar likes to feed these cancers.
Yeah, well, sugar is a fuel, and anything that's growing fast will suck on, more fuel.
Yeah.
And of course, if you're not absorbing the nutrients, your pancreas can't make the insulin. Okay. And so it's all kind of related. And so that's why you have to have injections. And it's the same way when it comes to blood clotting. Okay. You can't make platelets if you're not absorbing the nutrients for your bone marrow to make platelets, and you'll have bleeding issues.
We still got a few minutes here. So one last question.
Okay.
This person just posted reoccurring shoulder pain. I know the gluten's a big part of it, so we've already covered that part of it. So what's the nutrient side of that?
Okay, well, we have what we call the Healthy Bone and Joint Pact. There's 90 essential nutrients that are necessary to rebuild and maintain cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. Bone makes your bone itself. That includes the shoulder and the disc between the vertebrae, the neck, and all these other symptoms, okay, that are related to that, okay? People who get, for instance, atrial fibrillation. It's really a disc problem. When your discs shrink because you can't get the nutrients, you can't absorb the nutrients, your intestines are all damaged, and the vertebrae get closer together, they smash the roots of the first 4 spinal nerves, okay? You get what's called atrial fibrillation and tachycardia, fast heart rate. And doctors will want to do an ablation, which they open you up and they put a hot soldering iron in your heart, and they actually killed Elijah Cummings. This is just, got to be just a year ago. They killed the state U.S. U.S. congressman. They killed this U.S. congressman, Elijah Cummings, from Baltimore, Maryland, and he'd been a congressman for like 40 years. And they killed him on the operating table when all they had to do was come to us, and in 2 weeks' time, his tachycardia, okay, his fast heart rate and his AFib had been gone. And then if you get osteoporosis of the skull, okay, it squeezes the roots of the 12 pairs of cranial nerve in your spinal cord, including the 10th cranial nerve, the vagus nerve, which controls the rate and rhythm of the heart. You can also get AFib and tachycardia from that. And so you can have a two-source problem there. And so you got to get off all the bad foods, the fried foods, the processed meats, the oils, the glutens, wheat, bran, and oats. You take your 90 essential nutrients, okay, with the extra stuff, okay, for collagen, more glucogel, that kind of stuff, more of the things that are going to be necessary to make a disc, okay, the collagen peptides, vitamin D3, and it all goes away without surgery, without the risk of death.
Yeah, so to me, the bone and joint issues is some of the easiest things for people to help their body repair. Just making sure they get all those 90 essential nutrients.
Yeah, Pharmacist, I do this with professional athletes. I mean, that's their life, is their joints, and their back and their shoulders and their hips and their knees and their ankles and their elbows and back and so forth. So I created these things for professional athletes and Olympic athletes, and we have saved so many thousands of professional athletes, Olympic athletes, university athletes, backyard athletes,
right,
the company team athletes and so forth. This is easy stuff. Give us 90 days before you go see a surgeon.
Yeah, and what's causing all that pain is that bone is just grinding on the nerves and the you know, in the joint there, and it's causing pain. I mean, I've crushed my leg 2004, I think it was, and had a lot of pain for years after that, and thought that, you know, there's nothing you can do about it because it was a severe injury crushing my leg. And I'm embarrassed to say it, just a couple years ago, I started on the bone and joint program, and it was amazing what it did in such a short amount of time. The pain in my knees went away.
How long before you could actually see benefit?
Oh, it was just a matter of weeks.
Okay, and then how long had you had the problem?
Oh, I had it since I crushed that leg in 2004.
Well, there you go.
Yeah, so it amazes me, and that's why I said that's one of the easiest things to help people with. I know you've got to get off here. I want to thank you for your time today. This episode today is sponsored by HempFX Soothe. HempFX Soothe is, you know, I just mentioned that accident I had several years ago. Anytime the weather changes, you know, I get that pain in my foot. You know, it's a fantastic predictor of weather change. And when that happens, I just put a little bit of this HempFX Soothe on my foot, and it helps that pain go away. So, you know, maybe you've been working out in the yard or you work out at the gym and you get those tight, sore muscles and joints. You know, anytime that you need relief, you want to try the HempFX Soothe. It's made with a proprietary, organically grown hybrid hemp plant, and it's combined with several essential oils and other botanicals to help the CBD, the hemp plant, work even better. And that's what I like about Dr. Wallach and all of his programs, all of his nutritional products he's out there. He doesn't look at just one ingredient to solve a problem like most of the nutritional industry does. He looks at what can be combined together so you get a synergistic effect from it all. HempFX Soothe comes from USA sourced farms. It's non-GMO. And if you'd like to learn more about HempFX, visit aimhighwithhemp.com, aimhighwithhemp.com. And if you'd like to get Dr. Wallach's books, go to Dr. Wallach. That's Dr for doctor, J for his first initial, Wallach, drjwallach.com. You can see all the books that he has on his website there, and CDs and DVDs, and even I think you can still even find some cassettes on there.
Yeah.
So go visit Dr. Wallach's website and see all the wonderful books he's got there. And one last thing, I've got 2 free gifts for you just for participating in this Zoom. I've got the audio, Somebody Needs to Go to Jail, that Dr. Wallach came out with a few years ago, and he goes into all the reasons why the medical system is failing us. And the other free gift is a report on why young athletes die. So go to dddlvideo.com. It's DDDL, as in Dead Doctors Don't Lie, dddlvideo.com, and you get those 2 free reports. Dr. Wallach, I really appreciate your time.
Well, thank you so much, Pharmacist Keith. A beautiful job as usual. Thank you. And thank you for being so kind and talking to all of our distributors and so forth, and our customers and our patients. Thank you. God bless you. I think you are the only good pharmacist on earth. Thank you, sir.
I'm not the only good one, but I try. Thanks again, guys. And when you're on that website, the DDDL video website, there's a health evaluation that you can take there that will give you a better idea of where you stand as far as nutritional deficiencies and some of the ideas that you can use to help your body support your body's ability to repair itself. Dr. Wallach, I know you've got to go. Thanks a lot. I appreciate it.
Thank you. God bless you, sir.
God bless you. I hope you enjoyed today's episode with Dr. Wallach, and if you found value in the episode, please share it with others. Also hit that subscribe button, and be sure to hit that bell symbol and also select all so you'll be notified when I post a new episode in the future. Also, to get those free gifts that I mentioned in the video, visit dddlvideo.com. That's D as in David, D as in David, D as in David, L, video.com. And you'll get that report from Dr. Wallach on why young athletes die, as well as his video where he talks about how the medical system has failed us all. called Somebody Needs to Go to Jail. And while you're there, be sure to take that take Doc's health evaluation. The information collected is only going to be seen by me, and it's not going to be shared by anybody else. So visit dddlvideo.com.